Good morning, I'm Dr. Deuk Laser at Deuk Spine Institute, and I have here one of my patients who just underwent the Deuk Laser Disc Repair for his neck. He had herniated discs in the neck, and the surgery was done, today is Monday, the surgery was done on Friday, so just 3 days ago, right?
Yes, sir.
You're moving your neck pretty well.
I am amazed. It has been truly impressive. It's been a blessing.
Alright, so how are you feeling overall?
Overall, I can't believe how well I feel. I was just, you prepare for the worst and you hope for the best, as the old saying goes. And I am amazed. Your surgical team, the entire staff has been incredible. Right out of surgery, I could tell just an immediate difference. Had an automobile accident on January 24th of this year, and I have been in pretty intense pain every day since January 24th, and to feel the relief that I have felt since the surgery, again almost immediately after surgery, I just can't believe it.
Good. Well, I'm glad you're doing well. So before surgery you had neck pain, headaches, your arm was bothering you, and you had numbness in your hand. Right. Tell us about those symptoms now.
The headaches are gone. The shoulder pain has pretty much disappeared completely. I was having numbness in my hand, even up into above my wrist area. Right now, it has all dissipated except just for a little bit at my fingertips and the tip of my thumb. The neck pain is, I know there's some muscle issues, and honestly, it's like I told your staff this morning, I felt like the pain that I was feeling was maybe coming from the neck brace, not from
It is from the neck brace, yeah.
And so it's been incredible. I feel so much better. I was having real issues with being off balance. I was losing my balance very, very easily. Since the surgery, I've had one time, just once, that I got just a little bit of off balance, and I think it was just because of I made a turn too quickly. And but again, it's absolutely been a blessing. I can't tell you how grateful I am.
Well, what I found over the years, and I've done about 1,000 anterior cervical discectomy and fusion, so that would be one of the alternative surgeries that you would have been offered. And I found that with the laser surgery that we did on you, that patients really don't have much trouble swallowing or pain with swallowing. Is that what you found?
Absolutely. Went out to eat right after the surgery.
Good.
And had no problem chewing, eating, swallowing. Didn't have to worry about anything coming up after the meal. Drove back to Orlando where I'm staying with my family, and it was just it was smooth sailing. I was amazed how smooth it really was.
So with your surgery, and I know some of the people watching the video watched your surgery, was it outpatient surgery or inpatient in the hospital?
It was outpatient. Everything done here at your facility, at your office and your surgical facility, which the surgical suite, my wife was in the hospital industry for 30 years, and I've seen inside a few hospitals and spent a little time there with folks, and I was impressed with how sanitary, how clean, which that's the way it should be, but everything was just top-notch.
Yes, sir. Yeah, that's an interesting point you bring up, because we've had 0 infections in the 5 years we've been in operation, and that's because we keep our facility very clean and we take every measure possible to reduce the likelihood of an infection. Plus, you're not having any hardware put in, and your incision is only this big, so it kind of helps when you have small incisions and minimal bleeding. Now, you were talking to other spine surgeons before surgery. They were offering you more invasive surgeries, right?
They were. They were talking about going in and putting in, I guess, rods, screws, whatever, hardware was necessary or needed for the procedure. Spoke to one neurosurgeon about a minimally invasive surgery procedure, but when I did the research, when I looked at your video and met your staff, and certainly when I met you, to me it was a very easy decision what direction I wanted to go.
Well, had you met me 15 years ago, before I learned the laser surgery technique overseas, I probably would have done a fusion on you as well.
Sure.
But having the ability to do an alternative surgery that's better has really made an impact, I think, on many people's lives that I've been able to help, and it's sure made an impact on your life.
It certainly has. It certainly has. And again, I can't tell you how grateful I am.
Well, it's our pleasure to serve you and make you better. And is there anything else you want to tell our viewers?
I would encourage you, highly encourage you. I think, I said years ago, if I ever had a situation involving my brain, my back, my heart, and it was not an emergency situation where I had to have something done right then, I would be very thorough. I would be very detailed in my due diligence and my research to find the best procedure available. And I feel like God blessed me by introducing me to this man and his team. I feel like I was sent to this place for a reason, and I feel like I'm feeling there were a lot of prayers that went up for me. I pray myself. I'm strong in my faith, but I certainly feel like my prayers have been answered, and I am so grateful to have come here and had this procedure done. And I will be sending you a lot of business. I look forward to what we can do together to help other people overcome back and neck issues.
That's exactly it. I mean, that's why we're here, because I don't want anyone to suffer unnecessarily with back pain or neck pain.
Absolutely. It has been an answered prayer. It truly has. It's been a blessing. And again, thank you and your staff so very much. They're top notch.
You're welcome.
You bet.
Thank you.